Hey everyone, my name is Aaron Ho, and I'm going to be giving my presentation on the topic of breast cancer screening and awareness. So let's begin. What is breast cancer? So breast cancer is a type of cancer that occurs in the breasts. It can either occur in one or both of the breasts in humans. So what this means is that when you first have breast cancer or when it initially forms, it can either form in one breast or both simultaneously. Breast cancer occurs when cells in the body, specifically in the breast region, begin to grow at an abnormal rate, which it can potentially spread to different regions of the breast. So breast cancer could start off in one region and make its way all the way to the whole entire region itself. So some symptoms of breast cancer include any change in the size or shape of the breasts, pain in any area of the breasts, nipple discharge other than the breast milk, or formation of a new lump in the breast or underarm. So those are some symptoms to look out for if you want to determine if you have breast cancer or not. So some prevention methods of breast cancer include more frequent visits to the doctor for breast exams and risk assessment every 6 to 12 months, starting screening for breast cancer at a younger age, such as mammograms once a year, or taking other tests such as breast MRI to detect the presence of any breast cancer. So these are some methods that can prevent breast cancer from growing or spreading in humans. So some risk factors that enhance or raise your likelihood of getting breast cancer include being a woman, being above the age of 50 years old, or having certain changes or mutations in the BRCA1 or BRCA2 genes. So some ways to lower the risks of breast cancer include keeping a healthy weight, being physically active, staying away from alcohol, and if possible, breastfeeding your children, as well as if you know you have a genetic mutation within your BRCA1 gene or BRCA2 gene, talk to your doctor to see if there's any other ways to reduce the risk of getting breast cancer. So some general facts about breast cancer include each year in the United States, about 2,600, 264,000 women get breast cancer each year, and about 42,000 women die from the disease. It is not very common, but 1 in 100 breast cancers diagnosed in the United States are men. So typically, women are more likely bound to get breast cancer than men. It's very rare for men to get breast cancer. And breast cancer primarily affects women over the age of 50 years old. So typically, if you're over 50 and you're a woman, you are at a higher risk for breast cancer.